Go ahead and get started. Be cognizant of everyone's times. Appreciate everyone coming this morning. Hopefully the drive-in wasn't too bad for most of you. Avoided traffic. I got here early enough that I could avoid it. So again, thanks for being here. I do have just a quick participation question. I won't do this any other time throughout the day, but I'm just curious, how many of you work in either special ed or student services that are here? Okay, and then how many of you are treasurers or on the financial side? Okay, those are my people, the treasurer's financial side, but we have good topics this morning. Hopefully that'll apply to both of you. Hopefully you'll gain some good insights this morning. So you probably already saw the agenda when it was sent out ahead of time, but there it is again. That we'll have a few sessions here this morning. So to introduce myself, a lot of you have probably either emailed me or heard from me over the years, maybe not put a face. Same with you. So it's nice to put some faces with some names this morning. My name's AJ Knapp. I'm a principal here at Ray. I work out of our Millersburg office. I have been working in the Medicaid School Program doing AUPs for about 15 years now. I remember when Zach and I first got into it 15 years ago, I don't think we had any idea it would grow to what it has today. Very exciting to see the growth over the 15 years. Just a few housekeeping reminders for you this morning. So you weren't told when you came in, restrooms are right behind this wall here. So you can either go out that door and to the right or this door and to the left. There is breakfast out there for those of you that just came in and might not have been able to grab it. Feel free to grab it here quick. The first panel session starts at 9:10. I'm just killing 10 minutes. So maybe you need to grab some breakfast or something, drink coffee, water in the coolers. There's also pop if that needs to get you going in the morning, whatever it takes to get you going this morning. If you need the Wi-Fi network is Ray Guest, and the password, can't believe we haven't updated this yet, Zach. It's accounting is cool with spaces. So accounting space is space cool with an exclamation point at the end. But we're very excited that accounting is cool. So for my treasurers, financial people in the room, we did get this course CPIM certified. So when you came in, there was a sign-in sheet. Make sure you sign that. There were also forms out there that you'll need to fill out and submit to OASBO. We'll also send PDFs after the course to you that you can fill out and submit it electronically if you want to. But for today, make sure you do sign the sign-in sheet because that is needed to get your CPIM as well. A couple other things just to pay attention to. So we are recording today's event. These blue areas here on the ceiling are microphones. So just be careful if you're having conversations between sessions or anything that you might get picked up on the recording that we're going to send out after the fact. So watch what you say about me, I guess, is what I'm saying. No. So we will send all the slide deck and again, the CPIM certification form afterwards. So as you're going through today, don't feel like you have to take notes on every single thing that's said. You'll get the slide deck. Pay more attention to the content, what's being discussed, not trying to write everything out. Obviously take notes as you wish to. For those of you that sat on the sides and didn't want to be social, I don't know what it is, but make sure you grab a booklet, a pen. There's an evaluation form as well. If everybody can fill one of these out, and just leave it at their desk before the end of the day, that'd be perfect as well. I'm not going to be like a teacher and force everybody to come sit. I mean, the front row is wide open if anybody wants it, but I won't force you guys to do that. I think that is all of the housekeeping items. So to start, I'll call up our first session is going to be a panel of our billing experts. So Susie, Dan, Tracy, you guys want to come on up and have a seat. So with this, I'll have some questions I'm going to ask them as we get going, but I want you guys to be able to ask them questions as well. These are your experts from the billing agency side. So whatever questions you have, they're going to know the answer or they're going to be able to find you an answer. So as we go, I'll ask them questions, but then leave some time. So be thinking about some questions you want to ask them as we go. So because we'll definitely have opportunities for that. So before we start, how about you guys just introduce yourselves real quick? Susie, go ahead.
I am Susan Bolin and I'm with Westward. I'm the owner.
My name is Ian Thomas. I'm with Healthcare Billing Services.
Hi, I'm Tracy Regal. I am the Vice President of HPC.
So I've had the pleasure of working with each of these individuals for 15 years now as well. They might not say it's a pleasure working with me. I don't know, some days, but it's a great partnership we have from both the billing agency side and our firm at Ray here. So I rely on them a lot and ask them a lot of questions. So I urge you to do the same here today as you have questions. So to get started, Dan, we'll start with you. So what do you believe the importance is of obtaining parental consents, and how does not obtaining them affect MSP reimbursement for the schools?
One thing that we realize about the program is we're billing for medical services. So just like when you go to your physician and they have you sign consent to bill Medicaid, this program set up the same way. We need consent before we can bill Medicaid. It's done quite like it's done in your doctor's office when you first go as a new patient. They have you sign giving them permission to bill your insurance company and share protected health information is what you're really doing. And then annually, it also requires that you give a notification explaining what their rights are under the parental consent. So one-time signed consent and then annual notification, quite like what your physician does. We have some districts that they do a signed consent every year, and I think that's fine also. We'd rather have too many than not have enough. And I always like to stress that not only is it important that they sign the parental consent form, but we also want them to give consent because they can say no to that. So when they say no, then we're not able to process a claim for them. So it's important that we follow up on ones where we missed it or we didn't get it, but also those no's sometimes it's good to explain maybe more in detail what parental consent is. A lot of times there's concern that it's going to affect their lifetime max with Medicaid. It's going to affect services outside the district. Maybe they're getting some therapy services outside the district. Maybe they'll incur a copay. And it's really important to always tell parents that no, the answer is no to every one of those questions. It's not going to affect their lifetime match. They will not incur any costs for that. It's not accounting towards any deductible or anything for them. So it's important for them to know that. And the reason we want to get parental consent is if we don't get parental consent, that's potentially money we cannot bill for. So during the interim claiming process, we would not be able to process any claims for those students. Now, the good thing is when we file the cost report, we're not sharing protected health information. So we are able to capture that money down the road, but we're talking 2 years down the road. So, with budgets how they are, it's important that we get this money up front for you versus waiting several years down the road for that. And then we're always concerned too that the state or the feds may want to come in and factor out that parental consent during the cost report. There's actually some language in some guides right now where they could come back and do that. So we always want to make sure we're getting parental consent for those students. We like them to say yes if possible, but parents have the right to say no, that I don't want you sharing that information. And when if a parent asks, well, what information are you sharing? Most of it is information that's sent in a file that you would look at it and not even know what it even means. We're not sharing necessarily case notes with Medicaid. It's basically procedure codes, a date, obviously a student name and their Medicaid number. So it is protected health information, but it's good to let the parents know we're not sending all this detailed information on your child to Medicaid to get a claim paid. it's like what your insurance company would send in. So, it is important. I think that when to get that information and how to get it is kind of depending on the district. I find that one of the easiest ways is to have them sign that parental consent form when they're signing, when the parent's signing, I think it's the PRO5 form maybe, where you're giving them consent to test. Because that's really when our billing is going to start, when you start doing that assessment. So having them sign that in that initial intake process, the IEP meeting sometimes, if the parent shows up and we haven't gotten that signed yet, it's a good time to do it. But then after that, there's times when you don't see the parent. So it's really with your district, when that parent is initially involved, it's probably the best time to have them sign that form. The notification, there's various ways to do it, sending it out at the beginning of the school year with a packet of information that you send out. Some districts actually put on their website, the parental consent policy. What the rules say is that you have to notify them. So there's various ways to notify them. But the final reason we want to make sure we get parental consent is this bad guy over here, if he happens to pull a claim that was billed and there's no parental consent form, then he's going to write an adjustment for that. So we always want to make sure that we, have those on file to provide when they randomly select a claim to trace back and make sure all the documents are in place. We certainly want to have that parental consent form. So it's very common in the medical field for it, important for the program, and you do your best to get it. Your billing vendor probably lets you know the ones that they're missing. And we're never really telling you who's Medicaid eligible, but we do tell you when there's claims out there we can process if we just have that program. So, simple as getting one signed, it then alerts our system that's a billable claim now. And, a few months later, reimbursement comes in. So, an important part of the program.
We get labeled the bad guys a lot, and we've just become okay with that. So, but it is, like Dan said, and we'll get to it when I present later, an important part of our testing as well. That's the first thing we even start with when we're looking to test a claim is there parental consent? Because if there's not, it's automatically a violation and we're adjusting it off because it never should have been billed in the first place. So, all right. Thanks, Dan. So Susie, ready? So is there anything that stands out to you as a consistent finding from the agreed upon procedures?
From the bad guys.
From the bad guys.
I think the number one, and correct me if I'm wrong, is that we don't see a signature on the IEP or the service that was recommended from the therapist who recommends the services. So that can come into a problem if they're going from, I think, preschool to kindergarten, or maybe even into elementary school, where one therapist maybe recommends a service and that's their signature on there. But I think we've taught you in the past that then it's okay that the actual person delivering the services in the coming year is not on there. The problem we see is when it's a contracted service, because they're not always asked to come to an IEP, or they may not even know when there's an IEP, but there is definitely a space on the IEP for people to sign that were not in attendance, but recommended the service. And so our recommendation as a company is you need to put something in place, a process in place at your school, so that you have that person come and sign it. And they can sign it the day before, they can sign it on a separate sheet of paper, as long as there's a signature somewhere for that. So that's what we do. I started out saying, make a procedure, and learned quickly, oh no, that's gonna require board approval. So I like to use the word process, but there needs to be something. And whether it's the special education building is not a building that therapist is in very often, maybe write into your contracts that they come and they sign those IEPs once a month or something like that. I don't know what it's going to look like for everybody, but that's our suggestion, is that they need to be signed.
Yeah, definitely the number one item we see as well. And I guess to piggyback off that a little bit too, Susie, with that signature, one of the areas we see a lot of violations, and I might be jumping ahead to some of my presentation, but occupational therapists, physical therapists, we see a lot of assistants signing these IEPs. They are not qualified to sign an IEP to recommend those services be provided. There has to be a supervisor, OT or PT signing it. So
And they
that
can be invited to the IEP meeting, but
Yeah.
they're not going to be the person that's qualified for that signature. That's good. Thank you.
Yeah. All right, Tracy. Do you think school districts understand the new RMTS participation rules and the importance of accurately documenting their schedules within each specific district?
No, I don't think they do, and it's not because, it's not the school's fault. I don't think the information has been communicated well. And the transition to the new process was such a short time to have notification. So I don't believe that all the school districts and the individuals that are, required to oversee the random moment time study process completely understand the process. What has happened this year is the state plan amendment was opened up because of the expansion that we were expecting to happen. And when the expansion happened, federal Medicaid came in and they looked at our current random moment time study, the way it was. And they said we were not compliant with the new super guide rules from 2023 with our random moment time study for the school district. So there were many changes. One important change was that now we are going to participate with 4 quarters instead of 3. So everybody was scrambling in June to get a list of providers that you may think that are working at the beginning of the school year in August and what their schedule is going to be. We have to, or you have to really, the school, provide us a list of all the therapists that are working, and you need to have an appropriate schedule, a work schedule. When are they going to be available to get the moment in time? So that was one thing that was difficult. You're not going to be able to predict in June really who's going to be there in August because of the new 4th quarter. And then the other issue was they also said that contracted staff has to be on the random moment time study. Contracted staff has never been part of the process. So it's really important now that we're not looking for just district employees, but we have to come to you and say, we need a full list of everyone who's going to participate, and we need to have their schedule. And it needs to be based on their work schedule. So you're coming back to the billing vendors. It's very ironic because we're working now with the state billing vendor to try and figure this out, because HPC might have a contracted person and you're giving me a schedule, and then Susie and Dan might have that same person and they have a different schedule, and it's causing some confusion as how this is supposed to be reported. But while you're providing us the schedules that you're aware of, we're trying to figure out how it's going to work out in the random moment time study process. So it's really important that the therapists that are contracted must be on the list, because now what that means is if they're not in your random moment time study list, you cannot include their cost on your cost report. Prior, contracted staff, 100% went under purchase services and you can claim the whole entire cost. Now they're part of the random moment time study, so that person must be on the list, and we have to apply whatever the random moment time study percentage is to their cost. So it's not just about schedules, it's about the whole process. Also, they decreased the number of samples. So in the past, school districts, across the state for each quarter, we had over 3,000, was it 3,000 moments? 2,700 moments sampled. So 2,700 providers were sampled within each quarter. Now it's 443 moments in time. So these moments are very important to make sure we have good schedules, because we don't want to go out and sample someone and have everything come back saying they were not providing a Medicaid eligible service, because that will decrease the amount that you do get back on your cost report. And the schedule is really just something you have to work with the providers directly. I know with some of the contracted people, you might not know exactly when their schedule is, but we're also working with Brittany Miracle from the Department of Medicaid. We have many of your ESC providers that are crossing over and have different schedules. So we've kind of have been of the belief you need to get the ESCs involved and let them know, and maybe they're providing a list too. I don't know who that might be when we don't have the answer, but they could provide a better schedule, because some of these providers could be at multiple school districts and they're being reported multiple times. So we're kind of in the process of understanding it ourselves. I think that there may have been frustration with communication to the schools, because you're really getting a lot of the communication from the billing vendors. And unfortunately, we've been getting it at the last minute too. And so then we have to scramble, and then you guys feel like you're scrambling. And so we're trying to do our best, but please identify and know the 3 important things. Now there's 4 quarters, contracted providers are on there, and the sample size is smaller. The other thing is, before they used to be able to respond, they had, if a provider received a moment, they had 5 days to respond. Now it's down to 2 days, 48 hours. So, oh gosh, yeah, that one, see, keeps rolling out, keeps getting bigger. And now too, all of the participants are required to participate in a random moment time study training. We're the billing vendors, we can't provide training on random moment time study. It's basically a conflict of interest. The random moment time study coordinator, Solix, is responsible for providing training to all of the providers. I believe they offered originally 2 dates, one in August. That's correct. Yeah, and one when school was just coming back. And it wasn't really clear. And not only that, is as a school district, and they really haven't given us specific guidance, but you're responsible to make sure there's attendance records available in the event of an audit. So you need to make sure that any of your people who are on the participant list were in fact attending one of the training sessions. And so that becomes difficult if you have for us, I work with several ESCs, and I had suggested to the ESCs, make sure you get a list of everybody that was on your participant list. And they said it could be as simple as just putting the date that they were in attendance and signing it and keeping it in some form of a record that these individuals receive training, and then share that with your district. So they have that, you guys have that some of those contracted people or ESC people were trained, but also then you have to make sure your district employees were trained and you have a record of their attendance. And it is the school district's responsibility to make sure you have that attendance record. I don't know, this is new, so if you guys want to weigh in on any of that, it's.
Well, I think just acknowledging that the rollout of this was a disaster. It was not your billing vendor. We were quite embarrassed by, the system, crashing when 1,000 people tried to do the training. And so we are having meetings. We had 2 meetings this week with the time study vendor, and we're really trying to hold them accountable that they need to, have clear guidelines and better timeframes. And the good thing is I think the worst is behind us. We're fixing things. When you throw, several thousand new participants on, it caused a little bit of problems. And the rules for us kept changing, submit this. No, don't submit that way, submit this way. We've got a whole new set of rules that we've learned this week of how we're going to do the next quarter. So
Yeah.
It is going to get better once we get everyone in, they're in. So it's not like each quarter we're going to go through this, massive, uploading a bunch of new providers. And once we get it in the system, then each quarter it'll just be deleting ones that are no longer there and adding ones that are new. It's going to get better, but we do apologize for, it looked like it was not planned very well, and it was not planned very well.
It
So,
really was.
And the unfortunate part is all of these rules were being rolled out for the anticipation of the expansion, which was then put on pause. The rules have not been approved. So we're going through all these hoops and the expansion has yet to be approved. Maybe Brittany will be here. Is Brittany here right now? She'll be here to probably talk about that a little bit later, but, so I guess it's better we're making the mistakes now before it's this.
yeah.
And then don't forget, as it expands and when it comes out, there'll be another cost pool that you'll be able to, will be coming to you to ask for, and those would be administrative claiming. So again, those individuals will need to have good emails, good schedules from, and just to piggyback up what Dan said, as a billing vendor, it was difficult. And we felt bad for the school districts because we have been doing this way before all of us, probably over 25 years and under the CAPS program, the new program. And it's always been important for us to communicate to our school districts what's going on and correctly, and being misinformed ourselves made us look like we were the ones providing the instructions, that we apologize for that. We do.
I would just also add that they did only have 2 live trainings, but there is a recorded training. There's also a slideshow, and that is not the same as the recorded training. And Brittany will probably talk about where that can be located on the Medicaid site, or you can ask any of your billing agents, even if they're not the 3 of us, because we'll know where that link is for you. So that recorded training is available as well. But again, it's your responsibility to track who took a training. And I'm also understanding, am I wrong on this, you guys, that the very first time they log on to do a moment in any school year, they have to watch the slideshow. It's forced.
Right. It's an annual training.
So it's
not
not
just
just getting a training and a slideshow.
right.
It's overwhelming.
Go ahead, Tracy.
No, that's it. I mean, I like all of us. We, you have questions, ask your billing vendor. We have been working together with Department of Medicaid and the Solix, and Solix is the one responsible for hosting, providing training, and the Department of Medicaid is responsible for letting you know when those trainings are available. However, they do share that information with us, so we do try to reach out to you as well to share that information.
So a couple follow-ups, because I just see this on the back end too, so I'm curious what goes into it. So the contracted services side, I assume, correct me if I'm wrong, it's going to be calculated the same way as on the payroll side. All districts are in the same bucket. There's one RMTS for all districts, or is it on a district by district level?
One RMTS
One.
One RMTS.
today.
And then, and then,
And
any,
they do it backwards. They design the RMTS and then we'll do the cost report and then we'll figure out how we're gonna audit it at the end.
so,
I think we should have did it the other way. We should have designed the cost report, designed the agreed upon procedures, and then implemented, how to do the time study, but.
so with that, it's not just your individual district's responsibility, it's everybody. So, what everyone's doing is affecting this cost reimbursement. Any predictions on where that percentage may fall, you think, in the future? Is it going to be comparable to payroll, hopefully better than payroll? Because that can be a.
We just got the results and the results are very consistent with how they've been the last couple of years. So we're somewhat pleased, although we were always trying to get that number up. But we're pleased that it didn't go down. I mean, we were worried that they switched from 2,700 minutes to 400, but so far the first quarter
Consistent.
is not bad. We do have a problem with compliance with the first quarter.
Yeah.
We have to have 85% compliance and we're right under 85% compliance. So, which is understandable because we had all these new people in there. So, you'll see us policing a little bit more than in the past, probably because if someone just does not respond, it used to count 1 of 2,700. Now it's 1 of 400. So it really hits that percentage harder. But the only issue we had was being slightly under that 85% compliance rating. So,
Maybe explain what compliance is.
well, it means answering the moment. I mean,
Answering.
if you don't answer we have to have at least 85% of the moments answered. And some therapists, if they miss, we not only have 2 days to respond, if they don't respond after 2 days, it counts as a 0.
So I do want to, the state as a whole by federal Medicaid must be 85% compliant for the response over the year, each quarter. And what happens then in the random moment time study rules that they're putting out, it does state in there. Then if it goes below that, then they're going to look at every school district to see what percentage you are. And this has never happened, but last year, because there was a change in management and the way the program was ran, before there was an interagency agreement with Department of Education and Department of Medicaid. Now everything is under the Department of Medicaid, and also management roles changed. Last year, I had school districts that were getting emails from Department of Education saying, your school district fell below the 85% compliance rate. What are you going to do to correct this? And so we did have school districts that received these letters. So if you are a school district and you get one moment and that moment is not answered, you're now at 0% compliance. So it's really important to make sure that at district level, these moments are being answered. There is wording in that random moment time study manual that says if you continue to have that, the school may have to pay the money back, or there are some ramifications to it. They've always said that, but for last year was the first year they were following up on school districts that were falling below that 85%. And one thing that does make you fall below, is if you have a moment, a provider gets a moment and they don't respond, they didn't respond, but then you find out that the provider was on a leave, an unpaid leave, that's considered a non-response moment. So your school district is now considered 0%. So I keep asking, why do you count it like that? Do you know anything? So and there's nothing you can do if someone is out and they on a leave and it was unpaid and they didn't answer their moment, it's considered a non-response moment.
I'd
So-
say that's why we ask a lot of the special education
With a
departments,
favor.
Quarterly. First of all, we're asking you quarterly. Don't just look at the list we send you.
Right,
Really look at it, really make sure we've got the email correct. If we get the first one correct, and that's usually the hardest one to get back. But we'll say, do you know if anybody's going on leave, whether they're going to be on maternity? And there's always that person that, God forbid, maybe breaks a leg or something and they're out, unexpectedly. So, but just let us know. It's important that we know so that we can communicate that with Solix.
Can we follow up on this too? So the provider gets the notice the next
Yeah.
day. If they don't respond, we are then copied on that email. And I think the next day, then someone at your district, whoever we have assigned as the MSP coordinator at your district, is also copied on that. So we follow up and follow up with that provider. If they don't listen to us, then that's why you're copied on that third one. And when you're copied on it, that means there's very little time left to answer that moment. Yes.
So if the district is supposed to follow the live or recorded training and make sure that the therapists have completed that training, but there's no verification to say that they completed that training, is there somewhere I can look or just take their word?
they you just take their word for it.
Yeah.
They say they were in attendance and you sign and say, yes, they were here, or they signed or put it. They didn't even tell us, they won't tell us or give us guidance on what they want this attendance record to look like. So I guess best practice would be a list of them, the date they attended, and then maybe a manager's signature somewhere on the bottom, or
It doesn't have to be a live signature.
No.
I have several districts that are doing like a Google Doc. Once you've done it, type your name in there and
Yeah.
let us know you did and give a date maybe. But yeah, there's not a lot of guidance on that.
They basically forbid us from tracking that for you.
yeah.
We wanted to track it for you and they said, no, we do not want the billing vendor tracking it. We want the district tracking it.
I might have missed this. Is this gonna be a yearly requirement? Did you
Yes.
guys
Yeah.
say
Yeah.
yearly? Okay.
Back to you.
I think for the treasurers in the room, just from the audit side, I think that might be helpful here, learning work mechanism to track employees that are the folks attending. is just think about what you have to do right now for all the fraud reporting. Fraud training that's been issued by the AOS, you have to track. If you're using an HRIS system or some type of mechanism to track, you could easily set this up very similar to that and just document that. You could provide that. So just for the treasurers, we're just, thinking ahead a little bit that way. Capture this data. I do have one question. Here in AJ, when AJ voted the question, you've got all contracted therapists in one RMTS. Right. Could there be any consideration maybe down the road to separating out SCs versus private therapists?
We wanted to do.
Yeah.
Okay.
We wanted to do that.
Just thinking about it from the perspective of the ESCs or true shared services, that's how we treat them from a contracting perspective. We've used that from the bidding mechanism or exception of based on the relationship with the ESCs. We're essentially capturing their payroll benefit costs. So that makes sense to me. But when we look at it from a contracted therapist, your typical for-profit provider, they're billing on direct services.
And we're trying to get them to throw out the contracted agencies right now. We're trying to get them, we recognize ESC therapists are kind
Makes
of,
total sense.
Yeah.
but we're trying to get with the contracted therapy companies, the EJ Therapies, the Maximum Healthcare, who bill on an hourly basis.
Right.
We're trying to get them to exclude them from RMTS and treat that as a purchase service. And we asked Brittany today with Brittany's here.
Yeah.
Yeah.
To say, where it's in there, it's in there.
I just look at it and I feel like, on paper, it looks like districts are being somewhat, their fees are being reduced for something that's already billed on a direct basis.
Right.
There is no time study to look at. It's pure hours.
So imagine doing a time study for a therapy company that they work at school districts, they work at the therapy office, they work in a hospital. I mean, it's not like an ESC employee that all they do is work in schools. So that's our big argument. That's why we keep trying to get them to pull the CPA firms in, because we know you're going to look at it on.
That's what I was gonna say. I think it would be great if you would speak up about that during a conversation
I'm
because,
glad to just ask the question to be fair. I know we
Yeah.
had conversations, I think at one point with all three of you. Like you had mentioned, and it's like we started with the policy, working through, and then the audit is last.
or before the
So,
horse.
And I know when you were working through how you were going to communicate to the educational agencies, it's like, this is what I assume we would do, but until we provide this guidance, I really have no idea.
Right.
I would just also like to say, even though we're all competitors, the three of us are always collaborating and working hard together on your behalf, trying to push policy forward, like Dan's saying, we're trying to get them to throw that out. So, yeah, we work really hard behind the scenes, I think, as a group.
We do, which is good. I do want to add one piece that wasn't really brought up, or maybe some of you were thinking of this. And to me, I think about those small school districts who maybe just have contracted staff. In your prior cost report settlements, your allowable cost, you're applying that 100% cost on the cost report. And now, just remember, that cost is not going to be put in as purchase services. That cost does get the random moment time study percentage.
We factored down some.
It'll be your
Less.
cost, allowable cost is going to be less than it was in the prior years because of this change.
Yeah, and I think Zach's question was the very first question. I think Susie and I talked about this first. I'm like, why are they going to reduce direct bill services? They're charging whatever, $80 an hour. Why are you going to reduce that? That's time actually spent at the school.
Yep.
So, all right, moving on from RMTS, obviously
right.
a hot topic, but so I wanted to open it up. Obviously, a couple of you had asked questions specific to that, but if you have any questions at this point related to anything they've talked about or just anything in general, feel free. Yeah, go ahead, Carla.
I have a question, and and maybe my ignorance, but if we have a position that we know is contracted through an ESC, and we have a substitute because of a situation for the person, how do we know that they receive the training? Are they still included? I'm just ignorant about this. I've never thought about it until you were talking about it today.
It's a good question. And I think that's why, like, I had suggested to our ESCs that they make sure they keep a list with and work with their staff, because I'm going to the ESCs and I'm saying, here's all your providers, give me your schedules. But then I also went back and said, make sure you take this list, keep attendance. So maybe that person that's subbing was there and did receive it, and send it to all the school districts you work with so that you guys know for that year. So it really, we have to get the ESCs more involved in it. They have to be more informed on it. And what's difficult is, really the ESC should be sending in the list and all the schedules directly, because we had an issue where I have one provider that works at one of Dan or Susie's ESCs, but I don't know if Dan included that provider on his ESC list. It's really confusing. So you do need to make sure the list you send and include all of the providers that participate.
But to answer your question.
Yeah.
There are times when a therapist is not gonna be in that quarter.
Right.
If you hire them after the list has already been submitted, they're not gonna be in that quarter. If they're a sub, that quarter that's already been submitted, we're not gonna get them in there. We'll get them in the next quarter if they're still subbing, but
That's
there's
what I
really
was
just no
gonna say.
mechanism for that. We've talked about having an exception where if someone starts afterwards, or if it's a sub and they weren't able to get in that quarter for a reason like that, we should still be able to count their cost. But as long as they get in the next quarter that they're available to get in. But once again, they have not really responded to that, but that's one of the holes in a whole time study process, is that they start after we already submit the list.
It would be nice if we, from our standpoint, because we're just more or less of an oversight, or should be, had a checklist or something that we could be making this conversation, because we often don't make that conversation because we're not that knowledgeable.
Yeah.
And if we had a checklist and knew what to check for, I think it could improve the situation and make it more amenable for both parties.
We're definitely gonna be educating, ESCs and even districts on what RMTS is, and, because ESCs haven't had to worry about it.
And
Now
more
it's
so,
something-
also, it's really, really important for every district treasurer department and their special ed departments to talk, and know about what's going on in those things. So we try and coordinate that as well. One thing that's come up is, for example, we had a lady doing maternity, she's covering a maternity leave. And she was covering for the first quarter, and the lady's already back for October, okay? Which is the beginning of the second quarter. Well, every provider, if you're going to include their cost, or we're going to be able to do any interim claiming on them, they have to become a Medicaid provider. And a lot of you might not know anything about what that entails, but it entails a lot of their time. So I know our company works with them and tries to help them as much as possible, but they have to get an MPI number. Then they have to do a credentialing profile, and then they have to do a profile for Medicaid where they're actually applying for Medicaid number. The CAQH website, which is the credentialing website, because it could take you up to 4 hours to complete this application. It doesn't really, what we tell them, and maybe you guys do as well, is don't do anything without an asterisk, first and foremost. And the other thing is for you guys to be understanding of, it takes a lot of their time to do some of those things that they have to do. And we try and work with you as well, because annually they have to update their professional liability insurance, and they have to update it on both websites, those kinds of things. So there's a lot of detail in it. And if somebody's telling you, I need 2 hours, give it to them, because they really, really, really do need it for that purpose. And that's in order that you guys can get this partial reimbursement. So it is very important, and it's a lot of time.
If they're time studied during that time, that counts as Medicaid reimbursable administrative time.
Okay, anybody else? Question for the group? Yep.
Quick comment and a question. Dan worked with Debbie Miller on your team, so public shout out to her. She does a great job keeping us updated with parental parental consents that we need, and, that really helps us. And, in our updated vendor list. So that does help with the quarterly reports from you guys up there, keeping us updated with, hey, go check these off. The question is, apologize if I missed this, but is this like the random time study, annual audit, does it take place at a certain time of the year? And then part two would be like, if we're one of those 400 districts, one of those 400 time studies that gets pulled, can we, knowing that we only have 48 hours to respond, can we be on the front end of that as the district? No, it's like.
Only if they
30
allow you
long-
access to the.
So
It's
you
like
can't,
we're catching it on day 3, maybe hours left potentially.
Some of these rules are federal rules too, so,
Okay.
yeah,
The
I mean,
feds
like-
recently
like
changed.
not letting you know.
Some states don't get any notice at
you
all.
know what, I do want to say
It's not
though,
random if you know about it though, right? So.
the the provider is made aware.
Okay.
Ahead of time.
24 hour, it's a 48 hours prior to their moment in time. They're made aware that
They
they're
know-
going
they know
to
2
know.
days in advance.
But
Yeah.
we can't tell until after they miss the moment.
Yeah.
And I had been told by, after 2 hours of them missing the moment, they're emailing the provider right away, 2 hours after.
Yeah.
And then they start,
Every 24.
it's 24, 44, 40, 44 is the last. So, and whoever is considered your random moment time study coordinator at the district, we put on your email address. So you're also as a manager aware that they missed a moment. So, and we all,
And it's consecutive too, so like, they know 20 or 48 hours ahead, then they get 2 hours
Yeah.
after then at the moment, they get an email, then 2 hours after. Then after that, we get an email and they get an email. After that, we get an email, they get an email, and you get an email.
and the good news is if they work in 3 possible districts with 3 different vendors, all 3 of us
all
are
go
looking at one person.
They actually get 4 days, if you think about it. If you're told 2 days in advance, that's 2 days notice, and then you have 2 days to respond. So they actually have 4 days to respond. But like Tracy said, we don't know and you don't know until they get that moment. And that's when the clock starts ticking. And unfortunately, it's a couple days then. So, and that's directly from the feds. It's a rule change. They're making every state do it. There are some states that give 0 notice.
Yeah.
They don't tell you in advance. And so keep in mind, we're not telling you right now, today, at 1 o'clock, we're not saying, okay, we need to know what you're doing. We're telling you 2 days in advance, at 1 o'clock on Friday, we need to know what you're doing. So they're being told, in advance, and then they have 2 days after that to respond.
And I will make a suggestion. While we are your billing vendors and we do work together and we have ways to communicate and work closely with Department of Medicaid, your voice is so much louder than
Than
our
yours.
voice.
Oh, yeah.
And what I have been saying from the beginning of the year, they have been providing this provider training. How do you respond to a moment? When do you get a moment? What do you do? That's great, but they need to offer a training to you guys, the school districts,
Yeah.
so you understand it more. We do our best to communicate it, but you also need an open forum to ask them direct questions. And maybe that's something today, if you see Brittany, you need to say, we need to have training ourselves. We need it, and not the training on how the provider responds, a management level training. And that's what I would suggest.
And that's why the emails are so important too, because they maybe have a district email, their district requires it, and they work for an ESC and they have an ESC email. Well, which one are you gonna be looking at
Yeah.
most often? And if that's your Gmail account, then give us that. Because it really is important if they're only checking an email once a week or something, they could miss it.
Any other questions before?
It's still random moment.
Yeah. Hey,
It's a big-
like I said, it's a big topic. So, and I have a lot of concerns on our end, but we'll get there at some point. So
Start fighting this.
I'm not gonna hit that today. I could talk for an hour about my concerns probably, but.
Yeah.
Okay, all right. Dan, I feel like this is a really loaded question. So what is MSP expansion and when will it be implemented?
Okay, I don't want to ruin Brittany's presentation this afternoon, but I think it's good just to give you a little introduction about what Medicaid school program expansion is. And we have to watch that we don't call it Medicaid expansion. Because Medicaid expansion, that's what Governor Kasich did years ago when he added a third level of Medicaid, got more people on Medicaid, and that's Medicaid expansion for the entire program. You'll hear the term free care reversal used sometime, and that's really what this MSP Medicaid expansion was. This free care reversal would happen at the federal level, and what it did is it allowed districts to bill for more than just IEP services. So we have so this program has always been IEP services. The students got to bill on an IEP, but we have students who are receiving medical services on a 504 plan. We have students who are receiving medical services on a nursing care plan, and they're not on an IEP. We now have mental health plans out there. So Medicaid expansion is mainly designed to allow you to bill for services not listed on an IEP. Once again, still Medicaid. So we're never talking about instructional services, but medical services for students that are not on a plan. So that's really what Medicaid expansion is. And it's also going to allow you to bill for maybe some intervention services that were, or some crisis services that are not on a plan. It expanded some coding. So the feds, when they decided to do this, they decided that while we're at it, let's cross all these T's and dot all these I's of all these programs that, because we have 50 programs across the country. Everyone looks different. So that's when they came up with some of these other things that they put into Medicaid expansion. The notice for RMTS, relaxing the compliance for RMTS, allowing us to not test as many moments. But so Brittany this afternoon is going to talk about Medicaid expansion. We currently have the rules rewritten. We have procedure manuals being done. It's all being submitted to CMS, who has to approve all this. So at one time it was supposed to start the beginning of this school year. Now it's supposed to start beginning January 1, but trust me, it's not going to start this school year. It may be effective this school year, but there's a lot of things we have to do before we can start billing claims for behavior plans and mental health plans and nursing plans. Because Medicaid still requires a lot, time in, time out, scope and duration of services. There's a lot of things that the 504 plan or maybe those mental health plans do not have in place. So Brittany may talk about, they've developed a school services that will, it's going to have to be attached to what the plan you have. So I thought it was really interesting that in the time study results, we did have a couple people who qualified for expanded services and we haven't done it yet. So we have a percentage there, like 0.2%. I'm like, we haven't even, nothing's been approved yet. How are we coming up with a percentage for that? But it's not going to happen overnight. But I'll tell you another thing too. I remember at one time when the feds first unveiled this and we're now going to be able to bill for these other plans. And there were these wild numbers out there that it's going to double reimbursement. It's going to, it's going to open up a lot more money coming into schools. The states who have done it, and I think there's about 20 of them right now that's done it, they've seen about a 15 to 20% increase in their Medicaid. So it's not the dollars that one time were maybe associated with it. What will probably generate some additional dollars is when someday we finally do what's called Medicaid Administrative Claiming, or the MAC program. And that's part of expansion also. And that is where you're not getting reimbursement for direct service, you're getting reimbursement for those administrative staff that are actually coordinating services, attending IEP meetings, scheduling services outside the district, all those administrative tasks associated with providing services to students on plans. That is the state has put that off until next school year. Whether or not we'll be ready next school year, I don't know, so Medicaid expansion, it's exciting to get more reimbursement in your district, but it's not free money. It's not, a lot of times we'll say that we can get you money for services you're already providing.
Yeah.
You're already providing these services, but it's not free. It's not, there's a catch to everything. So the biggest catch is there's going to be another documentation that has to be done, called out. Pretty generic, but it's going to have all those different things that Medicaid requires before they will pay that claim. So Brittany will probably talk about Medicaid expansion. We were forced into doing it. We had to change our plan to comply with all these other things that are in, and you'll hear the term super guide. It's the CMS, it's the federal super guide. It's about that thick, and it has all these changes that they've made, and they're really just trying to, after 15 years of opening up programs literally in every state. I remember at one time when Ohio's program was approved, there were only probably 30 states that had Medicaid programs. Now every state has a Medicaid school program, and the feds just had to kind of take all those programs and get them all similar in compliance, and they call it Medicaid expansion. It will generate some additional money. But I would not anticipate that it's going to happen as quickly as just because it's effective, has a certain effective date, we're not going to be ready to do it by then. There's some things that have to be done, and we'll be walking you through that. We can't share that with you right now. Like our input has been, we've given our input on this plan, but we were told, don't share this plan with any schools.
Yeah.
So I would say this school year, later on, probably I would say after the holidays, we might start releasing more information, or the state might start releasing more information on Medicaid expansion. But just,
We received the paper plan, and well, the guidance and the instructions will follow. And we still haven't received those yet, so.
but it does not have CMS approval yet, and that will take a little bit more time. But I would say our goal would be, I think by next school year, to be able to let you know here's the expansion, here's what needs to be done. And I keep contending that some of your districts are going to say, we're not doing that.
Yeah.
I'm not going to have my therapist do a separate plan. We won't bill for those services.
Yeah.
So, I think at one time it was big money and a big thing, but now we're seeing that it's probably not as much as what we thought, and a little bit more work than we thought, but it's chugging along, but anytime you hear the term Medicaid expansion or MSP expansion, it's expanding into allowing reimbursement for non-IEP medical services is the main thrust of Medicaid expansion.
Susie, you already touched on this a little bit, but I'm curious if you want to expand. So hearing there's a lot of time therapists are investing in becoming Medicaid providers.
Yeah.
Is there anything you want to add to what you already touched on?
I already touched on that. I would say though, if I could touch on what Dan's saying is, with this expansion then becomes a whole new thing for school districts with record keeping. And what I've been told is you already know how to do record keeping, but IEPs are a federal program, and you know what you're supposed to keep and how long. And you're just going to have to, again, come up with processes internally. If I'm going to start doing mental health or individual health plans, which they already probably write those, and maybe, like we've been told, you can just piggyback that or staple that. It's still going to have all those little quirky guidelines that Medicaid requires if they don't already, which is, I think, what Dan was getting at, is that whole frequency and whatnot. But you'll also have to decide internally, how are you going to maintain that? Because if you're letting us know and we're billing that, you still for 7 years or 6 years passing an initiated audit, which then puts you up to 13. If they initiated in the 7th year, you're going to still have to have something in place in order to maintain that documentation. That's all I wanted to add to that, because I think that's
And one other thing about, we're talking about Medicaid expansion. One thing that we have changed is that parental consent form. The parental consent form said IEP, IEP,
Right.
IEP, IEP. So if you haven't changed to a new parental consent form that just says plan, you'll want to do that. Once again, we're trying to get ahead of the game so that we don't get a year from now and, oh, we're all ready to do Medicaid expansion and we realize we have no parental consent. Parental consent forms all say IEP. I wouldn't go back and redo any parental consent forms, but from this point on, I would use the new parental consent form that does not specify IEP because the past parental consent form, you were given permission to share IEP information. Now it's plan information. So make sure you're using a parental consent form that it is not specific to IEPs.
And probably your billing agents will provide you with that language. I know we will.
All right, we got about 10 minutes left, so Tracy, take less than 5 minutes on this question, then we'll open it up if anybody else has anything left. So Susie kind of segued this for you. So what are the rules of documentation retention and how do they apply to districts that will participate in Medicaid school program expansion?
So for Medicaid expansion, the same rules apply as they do currently. So if you think about when you go through agreed upon procedures, when they're doing the sampling of the 40 claims, if you are having the general population, a nurse bill for a 504 or some sort of healthcare plan, think about where these records are being stored and how they're going to be housed and how you will collect them so you do have them on an audit. Currently, when we go through the review process, they're looking at an evaluation, the ETR, the IEP, attendance records, a referral if it's necessary, and a billing documentation form. All of those guidelines will stay the same for the general population as well. As Susie mentioned, currently with special education, that's something we're just used to, keeping all those documents because we have to, and we have a good process in place. Who is going to be responsible for making sure these documents are being collected and stored and available? Because it just even starts down at the state level. If your accounting firm samples it, you have to be able to provide it. Parent consent has to be obtained for all of these children as well. And then there, as Dan said, there's going to be a universal healthcare plan that's going to be available that has to be attached to maybe a healthcare plan. If a nurse is in a building, where are these being kept? Where are they being stored? They need to be housed somewhere where management at the school district has availability to these records. So make sure before you do expansion, you look at your structure in the school district. Are we able to keep these documents? And I'm just going to tack on to real quick what Dan has said. Look at what the expansion has to offer. It's expanding into the general population, and it's really touching your nursing services and your mental health services. Those are that's where you're going to
work together, can't you? We're all answer.
That's where you're going to capture your expansion. That really, there are new CPT codes for OTPT speech, possibly, so you can get maybe additional funding for them in your interim. But at the end of the day, your allowable cost, the amount that you get for your program for direct services, would only be if you're adding new nurses and some of the mental health specialists, which some of those people and those nurses, they're. Are you saying we're not allowed to say what's on the plan? Wait. Oh, okay, because you're just like, we know the plan, but we don't say. I mean,
Share the plan.
okay, so we know that it's going to be there's a whole bunch of codes and opportunities for physician assistants if you hire those to bill, and you have that cost they can bill. And there's a lot of you could get physician assistants, advanced nurse practitioners, family therapists, what's called licensed family therapists, licensed family marriage therapists. So if you hire those, you're going to be getting some good expansion money coming your way.
Or if you're contracting out to a mental health clinic and
Yeah.
those people have those
Those guys,
licenses,
yeah.
then they can
Yeah,
counsel your
yeah,
kids.
yeah.
So it's
It's
gonna be all
just,
over.
it's just been kind of, I think Dan has kind of said, it's not as much as we thought it was going to be in the long run, but you will capture it if you have those nursing services, some of these behavioral health services that you're now adding to your participant list, and you're getting more cost, and that's where you're going to see it happen.
Are you gonna talk about transportation, and medical equipment later? Your presentation, transportation and medical equipment?
All right, we got about 6 minutes, so got time for a couple questions here. Go ahead.
I believe you answered that. Follow up. So, as a billing vendor, you are not able to train us as administrators of a school district.
I guess we're allowed to train you, but our training does not count towards the required training. So the state said
Right.
all therapists need to be trained on this RMTS. You know, we said, well, we trained them as part of our training, but and they said, no, that we want them to go through our training. So we can still come out and train your therapist. But as far as the requirement that every participant on RMTS be trained, it's that state training is, we can't say, oh, I've already been trained by the billing vendor. They want this specific state training.
I think, did you mean the administrators?
Correct. So I feel like I'm very lost when it comes to what's going on with Medicaid, as I've never been a provider. I haven't been a therapist. And so I've done this for 12 years, and we recently just got audited and we had some findings. And I had lots of questions about why these findings were found. And then I went back to legislation. So somehow I missed this. And so my question is, I would like to be trained on.
Oh, no, we can train you on what you need to have in place.
Somebody
That's
mentioned-
obviously something we can do.
You guys offer that?
Yeah, all, yeah.
All of us do,
Yes, all of
yeah.
us.
You just need to
Just need
reach
to
out.
request it. We can either come out and do it on site. We can do a Zoom meeting, however you want.
But
to.
I do think that my comment about asking Brittany to have a training with the on random moment time study to the school districts, I think it's necessary because ultimately it's you, the person at the school district that's getting the reimbursement, and they should provide that service to you. We know it, we provide it to you, but they've really never provided anybody at a school level this type of training. And I think it's just necessary. But honestly, I can speak for the three of us up here. We all provide our clients an overview of the program, what's required for a random moment time study. Unfortunately, the best we've tried this year, get the information, as we said, it's kind of been
As
not
it's
complete and not good. And so that's where we apologize because it hasn't been good for us to be able to communicate.
That might have been a misunderstanding on my part because, 13, 12 years ago, I would go on site and have training at a local. I have not seen that those have been offered recently. So the findings that we had, I was like, okay, where was this? How'd I miss this?
Yeah.
I don't think that's the right term. I think that's IP word.
Yeah, I know, we say findings and what does findings, mean? It's a red flag.
I would recommend, I always like it when a district, once we file our cost report, and especially if this guy has findings, the request of, a meeting with your billing vendor to go over his findings. And let's come up with ways to, number one, explain to you what this finding is and why we have it, but what we can do to eliminate those. And when we're talking about findings, I will tell you, the good thing about when they do have findings, they basically take away that one claim. They're testing 40 claims and take away that one claim. So it's a gentle slap on the wrist. Still important because what we worry about is that someday they may decide to extrapolate those when they find one finding out of 40 that they then say, well, out of 40 claims, we found one finding, but you had 400 claims, we're gonna take 10% away instead of just that one claim. So right now, they're just taking that one claim, but still, when you have findings, you probably should ask your billing vendor, hey, can we go over this, the cost report and the AUP?
It's an
But-
attempt to make those corrections ahead of time.
Right.
And the state on it.
But once again, what
Schedule
you're,
P. Guys, if you're special education, you need to be involved in looking at the Schedule P. It comes with the cost report. That's where the findings are, your findings are located. Tracy. Schedule B.
Yeah, and everything we're talking about, I'll go through in my presentation in a little more detail as well.
Okay, well, we can,
and I would.
They're stealing my
request-
thunder.
They're Brittany getting ready to come in now, but request to the state, I mean, we're very pleased that the AHA put this together. but we would love to see this on a grander scale
Yeah.
and more state participation. We used to do it years ago under the old CAPS program. We used to meet, gosh, I remember unair conditioned buildings but we would literally have 200 people there and it would be, Medicaid 101. And it would be for new people or just people who wanted a refresher, because I realize a lot of times you're given this job here, you're in charge of Medicaid and you're like, okay, what do I do?
Yeah.
Well, HBS or HPC, they'll help you through it. And you get these reports and you get this, and you get the cost report, you get the findings, and you're like, what am I supposed to do with this?
And
So don't
yeah.
hesitate to ask. And
Especially if it's a new role. I have noticed too, it's been hard that when there's a lot of changes at the beginning of the year and it's a new role, we'll contact and say, hey, you're new. We'd like to sit down and tell you what we do, but you're new. You're like HPC, Medicaid, I'm going to put that down here. It's not for the part that we don't try to communicate. It's just, sometimes it's hard for you to fit the time in. You're like, oh no, it's Medicaid. I was at another conference and I swear you sit at a table and people walk by, and there was all special ed directors. They go, oh, Medicaid. And they walk away.
They grab
I'm
a
like,
piece of candy
really?
and a pen and it's like, we don't.
I do have some good things to tell you. So, yeah, but thank you for your
Thank
time
you.
today.
Thank
We
you for
appreciate it.
Thank you all for presenting. Thank you for the questions. And just to expand on that piece too, I know I've had conversations with new treasurers that are coming into Medicaid school program and talking about what we're doing too. So obviously you're all here now, but I guess keep that in mind too.
I got a
And
call.
you guys should share it.
Thank you very much.
All right, we're going to take a 10-minute break. Be back in here about 10:20 for the next presentation.